Good afternoon. I'm Brenda Jones, the Director of the Shelby County Emergency Management and Homeland Security Agency. The Memphis Shelby County Joint COVID-19 Task Force press briefings have been changed to the Shelby County Emergency Management Operations Center. Shelby County Health Director Dr. Michelle Taylor will provide an update and its impact at the COVID-19 impact on Shelby County. Thank you. Dr. Taylor.
Thank you, Director Jones. I have some slides to show today. Total COVID-19 cases reported to date, 180,331. New cases reported today, 2,661. 576 of those new cases are pediatric cases. The 7-day average of cases per day is now 2,409. That is approximately twice the average just 1 week ago, December 30th, 2021, when it was 1,246. Next slide. The test positivity rate has increased rapidly and is currently at 42.4%, the highest we've seen since the beginning of the pandemic. The lowest positivity value we've seen was 2.3% in June of 2021. Next slide. The effective reproductive number, or RT, of the virus is now 2.02. An RT greater than 1 indicates that each case is infecting more than one other person, meaning that the epidemic is growing rather than shrinking in the community. Total COVID-19 hospitalizations as of January 5th, 2022, 575, with 103 in the ICUs and 472 in acute care. That is a significant increase in the levels reported just 1 week ago, and it indicates that COVID-19 is increasingly straining our hospital capacity. Next slide. This chart shows confirmed case rates per 100,000 population in the 6 metropolitan counties in Tennessee and counties surrounding Shelby County. As you see, Shelby County, shown in blue, has ticked up sharply. However, all the localities show an increase, which has accelerated since mid-December. Next slide. As this graph shows, Shelby County's daily new case rate is more than double Knox County's. Next slide. Hamilton County's. Next slide. But it is lower than Davidson County's new case rate of 304.4 per 100,000. Next slide. When you look at the daily number and percent positive tests, Shelby County has averaged more than 5,000 tests per day, significantly more than the other metro areas. Average percent of positive tests in Shelby County over the last 7 days was 46.4%, the highest of all the metro areas. Next slide. Currently, there are 23,892 active cases in Shelby County, and that is more than double the number of active cases reported just 1 week ago. The greatest increase in cases have been among 18 to 24-year-olds, 25 to 34-year-olds, 35 to 44-year-olds, and 45 to 54-year-olds. But the cases have increased across all age ranges, also with significant increases among children and the 65 to 74 age range. Next slide. This map shows active cases by zip code, with the darker areas having more active cases in those zip codes. You'll note that the darkest zip code is 38125. Next slide. This map shows active pediatric cases by zip code. Once again, the darker areas have more active cases. Next slide. This graph compares average case rates of children aged 5 to 18 years old in the 6 metro counties of Tennessee. Shelby County, shown in blue, shows a significant increase beginning in mid-December. Next slide. This graph shows vaccinations by vaccination date with first, second, and third doses, shown in differing shades of blue. In the past 7 days, 9,647 vaccinations have been given in Shelby County, which is a slight increase.
The broadcast is now starting. All attendees are in listen-only mode.
Next slide. Here you see the breakdown of the vaccinated population by age. 57.9% of Shelby County's population has received at least one dose of vaccine, but the percent fully vaccinated, having completed the series of 2 doses or more, remains at 49.7% of the population. The age 65 to 74 population is the most heavily vaccinated, with 79.3% fully vaccinated, and 25.2% of children aged 5 to 17 are now fully vaccinated, a percentage we would like to increase. And booster doses of Pfizer vaccine are now available for children aged 12 and older. Next slide. This slide shows the progress we've made toward our goal of having 70% of the population fully vaccinated. More than 465,000 residents are now fully vaccinated, representing 49.7% of the total population. So we still have a long way to go to reach our goal, but we are making progress. This is the end of the slides. The Omicron variant now represents 65% of active sequence cases in Shelby County, in analysis over the most recent 20 days. Some notes about testing. We still face limitations with testing, and the staff at the testing sites have been significantly impacted by COVID-19, as many other workplaces have been as well. Staffing issues have put a significant strain on the testing sites. We are working with the state of Tennessee, community testing partners, and governmental agencies to expand capacity at existing testing. We are also coordinating with the state of Tennessee to expand the number clinic is offering COVID-19 vaccines to anyone age 5 and older, no appointment needed. We are also working with community groups to offer vaccinations at community events on the Saturday before Martin Luther King Day. More information about that is coming soon. So before I introduce Chief McGowen, I will remind you, please continue to mask up, particularly in indoor public spaces, or when you do not know the vaccination status or the illness status of the people that you're going to be around. Please try to avoid large gatherings to reduce your risk of becoming infected with COVID-19. And please, if you are living in a household with someone who is positive, or you are positive yourself and you have other household members, and everyone else has mild symptoms, assume that you are infected and stay home. Do not go to the emergency room just for asymptomatic or mild symptom testing. We have many community testing sites that are open and available to help. And finally, please, if you are eligible to be vaccinated, get vaccinated. Now is the time. Don't worry about what you haven't done up until now. Today is the day to go and get vaccinated if you are eligible and you have not done so, or you have not taken advantage for the people in your life who are eligible. With that, I will bring on Chief McGowen.
Thank you, Dr. Taylor. Well, those are some sobering numbers. We have double the number of people in the hospital that we had 1 week ago and double the case rate that we had 1 week ago. Our forecast is that this weekend we will surpass the highest number of people hospitalized in Shelby County since we have begun the pandemic, and the trend will continue to increase from there. Unfortunately, we have very few therapeutic remedies that would keep people out of the hospital. We do not have a sufficient supply of monoclonal antibodies that are effective. We also do not have enough oral doses yet on hand to treat people in an outpatient setting. What that means is that we are going to have some very difficult days ahead here in Memphis and Shelby County, as we are experiencing in our country, all across the country. Our hospital systems are already taxed. As you heard Dr. Taylor speak to the point that not only are some of the testing facilities being impacted, but our staffs at the hospitals are not immune from contracting COVID and being sidelined from the workforce. They are strained with capacity. More people are going to the hospital because they are sick. They are having staffing challenges which makes it all the harder for people to be treated. And so it is incumbent upon all of us individually to do what we can so that we do not add to the burden that our local hospital systems have. I mentioned this a week ago. If you have not begun yet to understand the import and the impact of this, I encourage you to do that now and to take personal responsibility to neither contract nor spread this virus. And it's not just the folks at the hospital. All of the services in the public sector are not immune from contracting COVID. You've seen recently that we announced that MATA had to scale back some of its on-demand service because of lack of drivers who are sidelined because of the virus. Our police agencies and our fire agencies have significant absenteeism because people are either quarantined or isolated, making it more challenging for them to serve you. Normally, our firefighters are on a 24-hour rotation. They work 24 hours at a time. Many of our local agencies have had to put firefighters on for 48 hours at a time to provide adequate coverage. Our solid waste workers are not immune from this. We are challenged in order to pick up the garbage that you rely on every day. Our wastewater treatment plants and all of the core services that you rely upon are being impacted by this. So we have a difficult row to hoe. Our hospitalizations are going to continue to increase. The people that you rely upon for your core services are going to be challenged to provide those core services. And there is little that we can do to stem the tide except for ask you to take personal responsibility for ensuring that you do not contract the virus and you do not spread the virus. And so I would ask for some patience as well as your diligence. There will be times when services are challenging for us to provide. That is not because we are not trying. That is not because we are not putting every single person in the game to provide those services. And I would ask for some patience and some humanity over the next few weeks as things become incredibly difficult, and it appears that's the trajectory we are on. And so I'll end there and take questions for myself, Dr. Taylor, or Director Jones. And I encourage everybody, please, watch the numbers carefully and do what you can to prevent from adding to an already burdensome load that we have in our community. Thank you. Any questions?
Reminding all of our attendants to unmute themselves. First up is Kelly Roberts, WMC TV.
Kelly, are you unmuted?
Okay, can you guys hear me?
Yes, we can hear you.
Thank you.
Can you guys hear me?
Yes, we can hear you.
Okay. No. Okay, there's some technical difficulty either with the webinar or on my side. That's okay. I want to know about hospitalizations. If we reach a peak this weekend, where does that bring us back to requesting a mask mandate? I know that it has been not, the permission has not been given. Do we re-request? Where do we go from there? Thanks.
I'll let Dr. Taylor speak to that. I do want to mention, though, Kelly, that our hospitals will do everything in their power to ensure that they have capacity to treat sick people. So they will be taking action as well to make sure that we maintain that capacity. Dr. Taylor, you want to speak to the other question?
Thanks, Kelly, for the question. Of course, you know, we can always continue to make that request. You also know that that request was made last week by a letter from Mayor Harris and the Board of Commissioners. The request was turned down, but what I can tell you is, like Chief McGowen shared, the hospitals will do everything possible to continue to maintain the capacity to care for our sick residents here in Shelby County. In the meantime, if we feel that we need to make another request, we will do so. And we will continue to do that to let them know that we are going to have some pretty rough weeks. We are in constant communication with the Tennessee Commissioner of Health Dr. Piercy. But as you know, without an emergency declaration from the governor, which would be the first step, it's very difficult to take the next steps to be able to put some of those mitigation efforts back in place. In the meantime, we will continue to urge, just like I've done, just like Chief McGowen has done, just like we continue to do as a community, continue to urge everybody to do everything that they know works. We've had practice at this for 2 years, and everybody knows what works. A lot of the private businesses understand what works. They can issue their own mask requirements as private businesses and organizations. They do not need the Shelby County Health Department to do it. And it's protective. I've said this before. It's protective of their employees. It's protective of their clientele. It just makes good public health sense. And especially as we have the type and level of illness that we have in our community right now, it can't be any more important for all of us to pull together and to do the things that we know work.
Okay, and Kelly, do you have a follow-up question?
Yes, thank you. I'm wondering about vaccination status of those in the hospital right now. Do we have a count of how many are unvaccinated, and do we know anything about breakthrough cases during this surge? If those are making up a majority or what of the cases recorded? Thanks.
So Kelly, I can tell you anecdotally, because it's very difficult to track the vaccination status of hospitalizations until after the fact, so that data tends to lag. But I can tell you that anecdotally, providers and hospitals in the community are sharing that most of the people who are hospitalized with COVID right now are unvaccinated. That's the first thing. As far as breakthrough cases, I do have numbers. We have amassed those numbers since February. And so to give you a tighter timeline, I'd have to get back to you on that. But since February 1st of 2021, we have identified that the case of all the cases since that time, between February 1st, 2021 to January 6, 2022, 20.2% are breakthrough cases. So that means that the lion's share of cases have been new cases of people who are not fully vaccinated or remain unvaccinated.
All right, as of this time, that is all the questions that we have, and we will go to some closing comments, and if any other reporters wish to raise their hand in the queue, please go ahead. So closing comments, if you would.
We have shared this over and over again, but we will share it again. Please, if you are eligible to be vaccinated and you have not taken advantage of doing so, please do so. For the 50% of our population who is unvaccinated, and lots of them are eligible, you are putting yourself at increased risk of not only being hospitalized with COVID, but possibly dying a preventable death from COVID. Please go get vaccinated if you have not done so. If you've gotten one shot and you need a second, or if you've done the full series but you haven't been boosted, please go and do that. We know that the segment of the population who has taken advantage and become fully vaccinated and boosted, if they do have a breakthrough case with Omicron, are having mild symptoms and are recovering at home. The other thing to remember about the next couple of weeks, as Chief McGowen shared, it's going to be pretty rough. So as our hospital capacity is stretched, also the capacity to get other essential services in the community are going to be stretched, because we have such a level of illness in our community, and we have a large portion of our workforce who has become infected with COVID-19. So please continue to be patient with us. We will continue to do everything we can in our spheres of influence to protect the residents of Shelby County, and it's up to you to understand that we are in a personal responsibility moment and a collective responsibility moment where we're all tied together. And until all of us do the things that we need to do to protect ourselves and our families and our communities, we will continue on this marathon called COVID-19. But we can get through this together. Thank you.
Thanks, everybody. We'll see you next week.